If you are over 60, there is a very high chance you are taking this medication. It's one of the most commonly prescribed drugs in the world. Doctors give it out every day. Millions of seniors take it for years without a second thought. And for good reason, it works. But here's what many people are not told clearly enough. Over time, this common drug can quietly reduce your body's ability to absorb essential vitamins. And when those vitamins drop, the symptoms often look exactly like aging. The medication we're talking about is Metformin, widely prescribed for type 2 diabetes and blood sugar control. Metformin has helped millions manage blood sugar safely. For many people, it's an important and effective treatment. This is not about fear, it's about awareness. Because long-term use of Metformin has been linked to reduced absorption of vitamin B12, one of the most critical nutrients for seniors. And vitamin B12 is not optional. It plays a major role in nerve health, red blood cell production, brain function, energy levels, balance, and coordination. When B12 levels begin to fall, the body doesn't always send loud signals at first. The changes can be subtle and gradual. You might start feeling more tired than usual, even when you sleep well. You might notice tingling in your hands or feet. You may feel slightly off balance. Your memory might not feel as sharp. Your mood may shift without clear reason. Because these changes happen slowly, most people assume they are simply getting older. But in some cases, it's not aging. It's deficiency. Why does Metformin affect B12? Metformin works, in part, by changing how your body processes glucose in the liver and intestines. However, it can also interfere with how B12 is absorbed in the small intestine. Over months, and especially years, this reduced absorption can gradually lower B12 stores in the body. And here is something important. B12 deficiency can take years to fully develop because your liver stores it. That means someone can take Metformin for a long time before symptoms appear. By the time noticeable symptoms show up, levels may already be significantly low. Why seniors are at higher risk? As we age, our ability to absorb B12 naturally declines, even without medication. Stomach acid production decreases. Digestive efficiency changes. Some seniors already have borderline levels without realizing it. When you combine age-related absorption decline with a medication that further reduces B12 uptake, the risk increases. That is why doctors increasingly recommend periodic B12 monitoring for long-term Metformin users, especially adults over 60. What happens if B12 gets too low? This is where it becomes serious. Mild deficiency may cause fatigue and brain fog. Moderate deficiency can lead to numbness or tingling in hands and feet, balance problems, weakness, memory decline, mood changes, pale skin. Severe or prolonged deficiency can lead to nerve damage that may become permanent if not corrected early. And this is why awareness matters. Because if someone believes the tingling or memory issues are just aging, they may never get tested. Are there other medications that deplete vitamins? Yes. Other commonly used medications can also affect nutrient levels, including proton pump inhibitors for acid reflux, which may reduce B12, and magnesium absorption, certain diuretics, which can lower magnesium, and potassium, some cholesterol-lowering medications, which may affect CoQ10 levels. The point is not to stop medication. The point is to monitor intelligently. What should you do if you take Metformin? First, do not stop taking it abruptly. Blood sugar control is critical. Instead, consider these steps. Ask your healthcare provider about checking your vitamin B12 levels, especially if you've been on Metformin for several years. Discuss whether periodic monitoring should become part of your routine blood work. If levels are low, your provider may recommend oral B12 supplements or, in some cases, injections. B12 supplementation is generally safe and inexpensive, but it should still be guided by medical advice. The goal is balance, not fear. Medications save lives. They improve quality of life. They are often necessary. But every medication has effects beyond its primary purpose. As we age, our bodies become more sensitive to small imbalances. A mild deficiency in your 40s may feel manageable. In your 60s or 70s, that same deficiency may affect your balance, cognition, and independence. Sometimes protecting your health is not about adding more prescriptions. It's about understanding how the ones you already take interact with your body. If you or someone you love takes Metformin, this is not a reason to panic. It is a reason to stay informed. Fatigue is not always aging. Tingling is not always aging. Memory shifts are not always aging. Sometimes they are signals. And when caught early, vitamin deficiencies are often reversible. The most powerful thing you can do is ask questions, monitor regularly, and advocate for your long-term health. Because aging wisely means paying attention, not assuming decline is inevitable. If this information was helpful, consider sharing it with someone who takes daily medications. Awareness could make a meaningful difference in their quality of life. Your health is worth understanding.